Okay.
These are absolutely clear benefits and are the reason
Nancy,
we are supporting this legislation.
Thank you so much. We're going to have to stop you there. We're going to go to Steny Hoyer now. We appreciate you being with us. House Majority Leader and Democratic Representative from Maryland, Steny Hoyer. Steny, it's always great to see you. I remember back in 1996 when you were running for re-election. I love this because you're in a swing district, even though you win by about 1,000 percentage points. But it was after the contract with America, and this radio ad was talking about Steny Hoyer. He supported in the contract with America. And it shows that, you know, people go back and forth, and there are a lot of moderates to conservatives in your district. You know what the ads are going to be, though, this next year? Steny Hoyer. He supported $500 billion cuts in Medicare. I heard all the advantages of donut holes and waffle syrup and all that other stuff, but this is a tough sell for people that are voting you for majority leader. $500 billion in cuts for Medicare. How do you do that?
Well,
how do you justify that? How do the members go back home and sell it?
Well, the same reason that Nancy Lamont pointed out. Frankly, the Republicans created what is called Medicare Advantage. Medicare Advantage has private sector. It's overpaid. Almost everybody believes it's overpaid by 10 to as much as 25 or 30%.
So Steny Hoyer is saying that seniors are getting too much.
No, I didn't say the seniors were getting too much.
You said they overpaid.
I mean, Joe, that's your spin. My spin is the insurance companies are getting too much.
Let's just talk about the politics of it, because you and I both know Medicare has to be cut over the next 10 years or the system goes bankrupt.
Let me tell you, Medicare is not sustainable.
Yeah, it's not sustainable.
Not sustainable.
So
we know
all I'm asking you here is how do the Blue Dogs sell this going home? It's heavy lifting for a lot of them.
I think what they're going to sell is that this is going to ensure affordable, quality health care for all Americans, and that's what we need to do. We have some 50 million people who aren't in the system. All of us who are paying in the system, paying premiums, are paying on average $1,100 more on our own premiums for those who are not paying anything, who are not in the system, but getting health care. So this is an effort to get everybody in the system. CBO says we add about 36 million of the uninsured. We don't add any illegals. That's about 12 million into the system. So we're letting people get access to affordable, quality health care that they can count on. Right. And we think that's a significant, important step forward, and that's why AMA has endorsed it. That's why AARP has endorsed it. That's why Consumer Reports has said this is a good deal for consumers.
Yeah, if you can get it through, though, Congressman, let me read from roll call real quick here. Congressional Hispanic Caucus Chairwoman Nydia Velázquez warned President Barack Obama on Thursday that 20 members of her caucus are prepared to vote against the House Democratic health care plan if language restricting the rights of illegal immigrants to buy insurance is added to the bill.
So it does actually allow illegal immigrants, as written, to get health care reform, right?
Well, no, it does not. It specifically prohibits. The issue here is, as we know, hospitals, as I think morally we would want them to do, if somebody presents themselves to an emergency room and is hurt and needs emergency care, gets it. There's no check as to your papers or anything like that. If you have a traumatic injury,
says this is about buying health insurance under this federal plan. There can't be restrictions, according to this report, for illegal immigrants buying insurance under the plan.
What the language is going to specifically say is there will be no federal funds used for anybody who is an undocumented individual to purchase through the exchange insurance. No federal assistance to achieve that objective, period.
So is this roll call report
very, very clear?
Because it says,
excuse me?
Is this roll call? And I'm sorry, we have a delay, and I apologize. I've stepped on you too many times here. But again, we have the Hispanic Caucus Chairwoman, according to roll call, quote, warning President Obama that 20 members of her caucus will vote against the House Democratic bill if the language restricts the rights of illegal immigrants to buy insurance.
They have to prove their
right.
Yeah, what she is not referring to the House bill. She's referring to possible language that might be added. And we're talking to not only Nydia Velázquez, but the Hispanic Caucus today. Clearly, this bill is designed to, and we believe does, cover those who are in this country, citizens, and those people who are in this country and are authorized to be so, to facilitate their getting health insurance, to bring premium costs down for all Americans, to bring costs down for our system, and to, as I say, make sure that health care is available. It does not provide provide for health care. The House bill does not provide for health care for those who are not here in a legal basis.
Hey, Steny, I've got a ticket.
Yeah.
Because I haven't gone to, University of Alabama graduate.
Hang out.
I haven't gone to a football game yet, and Alabama's playing LSU on Saturday.
Yeah.
I'll tell you what I'm going to do. I will get a jet to come pick you up. We'll fly down to Tuscaloosa. This will be the funnest Saturday you have ever had. You want to come on down on Saturday? I mean, what are you doing Saturday?
Joe, I've got a few things I'm doing Saturday. We hope to pass this health care bill on Saturday. We expect to do that. And we think that when we do, this will be a huge day for all Americans.
Well, I'll tell you, Steny, if you pass it, I'm deadly serious here with the senior issue, the Medicare issue, the tax issue, the abortion issue that the Post is talking about, the cost issue, illegal immigration. This is going to be a heck of a legislative achievement for you. I'm just saying politically to put all those people in line. A tough Saturday ahead, Steny, but good luck. It's great seeing you.
Let me make an issue. You mentioned all these costs. This bill, however, is paid for. Unlike the past prescription drug bill, which added $500 to $600 million to the deficit, CBO says we bring down the deficit.
So is it 890 billion like Nancy said, or is it over $1 trillion like the CBO said? Which one is right there?
What CBO said was the net cost was $894 billion. But then they add in the $160 billion extra, which gets it over $1 trillion, which is paid for in lieu of providing insurance by businesses. You either pay for it or you make a contribution towards the insurance of your employees.
Steny, I love you.
Thank you.
Lots of luck.
Happy Saturday, and MSNBC will be covering that.
We're covering live. It's going to be exciting.
Up next, Savannah Guthrie and New York Governor David Paterson. You're watching Morning Joe, brewed by Starbucks.